Strong bones are crucial for a healthy and active life. They provide support for our bodies, protect our vital organs, and enable us to move freely. Maintaining bone strength is a lifelong endeavor, and a balanced diet rich in essential minerals is paramount. This essay will delve into the crucial roles of calcium, magnesium, and vitamin D in bone health, providing you with the knowledge to make informed dietary choices. Our bones are living tissues that constantly regenerate throughout our lives. This process, known as bone remodeling, involves the removal of old bone tissue and the formation of new bone. Adequate intake of essential minerals is vital for this process, ensuring that our bones remain strong and resilient as we age. Neglecting these nutritional needs can lead to weakened bones, increasing the risk of fractures and conditions like osteoporosis. This essay will serve as a guide to understanding the specific roles these minerals play and provide practical tips for incorporating them into your daily diet. By prioritizing these nutrients, you can significantly contribute to maintaining strong bones and enjoying a vibrant, active life for years to come. Remember, taking care of your bones is an investment in your long-term health and well-being. Calcium is the most abundant mineral in our bodies, with about 99% of it residing in our bones and teeth. It provides the structural integrity that makes our bones strong and resistant to fractures. Think of calcium as the bricks that form the foundation of a sturdy house. Without enough calcium, our bodies cannot build and maintain healthy bones. The recommended daily intake of calcium varies with age. Adults generally require around 1,000 milligrams per day, while children and teenagers need even more during their growth spurts. During pregnancy and breastfeeding, women also have increased calcium needs to support the developing baby. Fortunately, calcium is readily available in a variety of foods. Dairy products like milk, yogurt, and cheese are well-known sources. However, many plant-based options are also excellent sources of calcium, including leafy green vegetables like kale and spinach, tofu, almonds, and fortified plant milks. While calcium often takes center stage, magnesium plays an equally important role in bone health. Often overlooked, magnesium is essential for calcium absorption and utilization within the body. It acts as a regulator, ensuring that calcium is properly deposited into our bones and not accumulating in soft tissues where it can cause problems. Magnesium also contributes to the production of calcitonin, a hormone that helps regulate calcium levels in the blood and promotes bone formation. Additionally, magnesium plays a vital role in muscle function, which is essential for maintaining balance and preventing falls that can lead to fractures, especially as we age. Including magnesium-rich foods in your diet is easier than you might think. Dark leafy greens, such as spinach and collard greens, are excellent sources. Nuts and seeds, particularly pumpkin seeds, almonds, and cashews, are also abundant in magnesium. Whole grains, legumes, and dark chocolate are other delicious ways to boost your magnesium intake. Vitamin D plays a crucial role in calcium absorption. It acts like a key, unlocking the door for calcium to enter our bones and build strength. Without sufficient vitamin D, our bodies cannot effectively absorb calcium from the food we eat, rendering our calcium intake less effective. Our bodies can produce vitamin D through exposure to sunlight. However, factors like geographical location, time of year, and sunscreen use can affect vitamin D production. Therefore, it's essential to include food sources of vitamin D in our diet or consider supplementation, especially during winter months or if sunlight exposure is limited. Fatty fish, such as salmon, tuna, and mackerel, are excellent sources of vitamin D. Eggs, particularly the yolk, also contain a decent amount. Additionally, many foods are fortified with vitamin D, including milk, orange juice, and some breakfast cereals. Checking food labels can help you identify fortified options. Building a strong foundation with the right food sources is crucial. Incorporating a variety of calcium, magnesium, and vitamin D-rich foods into your diet is key to building strong bones. Aim to consume a balanced diet that includes dairy products or fortified alternatives like milk, yogurt, cheese, and fortified plant-based milks, which are excellent sources of calcium and often vitamin D. Don't forget about leafy green vegetables such as kale, spinach, collard greens, and bok choy, which are packed with calcium, magnesium, and other bone-boosting nutrients. Nuts and seeds like almonds, cashews, chia seeds, and pumpkin seeds are good sources of magnesium and healthy fats that aid in nutrient absorption. Fatty fish, including salmon, tuna, and mackerel, provide vitamin D and omega-3 fatty acids, which also contribute to bone health. Eggs are a good source of vitamin D and protein, both essential for bone health. Remember that variety is key. By incorporating a diverse range of these foods into your meals and snacks, you can ensure an adequate intake of these essential minerals and build a strong foundation for a lifetime of healthy bones. Maintaining strong bones throughout life offers numerous benefits that extend far beyond simply preventing fractures. While fracture prevention is crucial, especially as we age, strong bones also contribute to improved posture and mobility. Strong bones provide the structural support for a healthy spine, leading to better posture and reduced risk of back pain. This in turn allows for greater ease of movement and flexibility. Increased energy levels are another benefit. When your body doesn't have to work as hard to compensate for weak bones, you have more energy available for daily activities and exercise. This can lead to a more active and fulfilling lifestyle. Reducing the risk of osteoporosis is also significant. Osteoporosis, a condition characterized by weakened bones, becomes a significant concern as we age. By building strong bones from a young age and maintaining them throughout life, you can significantly reduce your risk of developing this debilitating condition. Lastly, for individuals who engage in physical activity or sports, strong bones are essential for optimal performance and injury prevention. Strong bones can withstand the impact and stress of exercise, allowing for greater power, speed, and agility. Beyond diet, there are additional tips for bone health. While a balanced diet rich in calcium, magnesium, and vitamin D is fundamental for strong bones, several other lifestyle factors also play a significant role. Incorporating these habits into your routine can further enhance your bone health. Regular weight-bearing exercise like walking, running, dancing, and weight training puts stress on your bones, which stimulates them to become stronger and denser. Aim for at least 30 minutes of weight-bearing exercise most days of the week. Adequate sunlight exposure by spending time outdoors and exposing your skin to sunlight allows your body to produce vitamin D naturally. Aim for 10 to 15 minutes of sunlight exposure on your arms and face a few times a week. Maintaining a healthy weight is crucial. Being either underweight or overweight can negatively impact bone health. Being underweight can lead to lower bone density, while being overweight puts excess stress on your joints and bones. Limiting alcohol and caffeine intake is also important, as excessive consumption can interfere with calcium absorption and increase calcium loss through urine, potentially weakening bones over time. By combining a nutrient-rich diet with these lifestyle modifications, you can create a comprehensive approach to building and maintaining strong bones throughout your life. Building strong bones is a lifelong endeavor, and it's never too early to start investing in your bone health. While we often associate bone health with aging, the foundation for strong bones is laid during childhood and adolescence. During these crucial growth periods, our bodies are building bone mass at an accelerated rate. Ensuring adequate intake of calcium, magnesium, and vitamin D during childhood and adolescence is paramount for maximizing peak bone mass, which refers to the highest bone density an individual achieves in their lifetime. Reaching a higher peak bone mass provides a protective buffer against age-related bone loss later in life. Parents and caregivers play a crucial role in shaping healthy dietary habits early on. Encourage children to consume calcium-rich foods like milk, yogurt, and cheese, and incorporate leafy green vegetables, nuts, and seeds into their diets. Additionally, ensure they get enough sunlight exposure or consider a vitamin D supplement, especially during winter. Listening to your body and recognizing signs of deficiency is essential. While severe deficiencies in calcium, magnesium, and vitamin D are relatively uncommon, it's essential to be aware of the subtle signs that your body might be lacking these essential nutrients. Addressing these deficiencies early can prevent long-term consequences for your bone health. Signs of calcium deficiency include muscle cramps, brittle nails, fatigue, and dental problems. In severe cases, it can lead to osteoporosis and an increased risk of fractures. Symptoms of magnesium deficiency can include fatigue, muscle weakness, insomnia, and anxiety. Chronic magnesium deficiency can contribute to osteoporosis and other health issues. Feeling tired, experiencing bone pain, having frequent infections, and experiencing hair loss can be signs of vitamin D deficiency. Long-term deficiency can lead to weakened bones, increasing the risk of fractures. If you experience any of these symptoms, it's essential to consult with your healthcare provider to determine if a deficiency might be the underlying cause. They can recommend appropriate testing and advise on dietary changes or supplementation if needed. Conclusion: invest in your bone health today. Strong bones are not merely a matter of genetics, they are a reflection of the choices we make throughout our lives. By understanding the crucial roles of calcium, magnesium, and vitamin D, and incorporating food sources of these nutrients into our diets, we can significantly influence our bone health. Remember that building strong bones is a lifelong journey that requires consistent effort and attention. Embrace a proactive approach to your bone health by making conscious dietary choices, prioritizing weight-bearing exercise, and ensuring adequate sunlight exposure or supplementation. By investing in your bone health today, you are securing a future filled with vitality, mobility, and independence. Make every bite count and enjoy the benefits of strong, healthy bones for years to come.